There is a lethal cancer called mesothelioma, which is a cancer arising not in the lung, but the covering of the lung. It used to be one of these diseases which causes a lot of symptoms. What has kind of really changed is that again the use of immune therapy. So when I was a trainee, we as clinicians or researchers, we love to publish in certain high impact journals. And one of the highest impact journals is something called New England Journal of Medicine, which has an impact factor of extraordinary number. What it does is that it's widely read and it's practice changing. So when I was a trainee, this cancer, the first drug called bevacizumab was added to the chemotherapy backbone, and that was the first time this had changed for like 30-40 years. But in short sequence, we've discovered immunotherapy probably works for this cancer even better. Now I have two patients who are currently undergoing treatment under me in the private sector, and I really enjoy treating them because I've seen when I was a trainee, the hopeless situation has changed into a significantly positive outcome. Both of them, I started them on immunotherapy, and they got a significant amount of benefit for immunotherapy, lasting for about 12 to 18 months. And the other person is still on immunotherapy. Then I used a switching strategy where I changed that from immunotherapy to chemotherapy when I realized the scans are showing some degree of progression. Now that patient has demonstrated an enormous amount of benefit from the chemotherapy. I feel like that is probably because of the sequencing. So one of the commonest problems now we have as oncologists is what is the correct sequence in terms of using these drugs. As I told you earlier in one of my videos, is that we are absolutely spoiled for choices in terms of drugs, especially in the hormones positive space. We have so many newer drugs and we don't know where to kind of use that, and that's why this enhanced diagnostics, molecular analysis really comes into play. I can sort of like pass through all this data, the nuances, and see, oh, this drug is probably the best drug at this particular window to treat your cancer. Same thing. So with mesothelioma, what we've done is like I always give immune therapy drugs because it's much better tolerated than chemotherapy. Get the maximum mileage out of immune therapy and sequence it with chemotherapy, and they get further mileage out of chemotherapy. Now the second person is exceptionally fortunate in this context. His quality of life is drastically improved despite being on chemotherapy because I managed to completely destroy that cancer with the chemotherapy after sequencing after immune therapy. When you look at the scans, he initially had about a 9 to 10 millimeter thick layer of cancer in his lining, and now I can hardly see the cancer in the scan, and it's probably mostly scar tissue. The amount of symptom burden he had right at the beginning is enormous. He had cough, he couldn't sleep, he was losing weight. All these symptoms are completely disappeared now, and he's sort of living his own life. And at the same time, as part of a clinician who looks at a holistic aspect, there are certain medical legal implications because most of the mesotheliomas, or almost all of them, I would say more than 80%, are due to asbestos exposure. There is a long lag period. That means from the initial exposure to the diagnosis of cancer, sometimes lasting 40 to 50 years. But you can always trace it back to where that person actually worked, and that's the reason. So we commonly work with legal profession as well and see, can we get them the maximum compensation as well in a way to make sure that will help with the final stages of that patient, look after their family, and also help with the treatment as well because they can access some of the newer drugs as a result of this. So these are the things that we want to do holistically, and I always kind of incorporate everything along with exercise, diet, make sure we give an integrated plan, getting the physiotherapists, dietitians involved, so we fight your cancer significantly better than maybe even 5 or 6 years back.